This is, and some of you saw this. This is the article was from June 16th of 2015, and it came from Scientific American, and the title was "Electric Cures." It said bioelectric medicine could create an off switch for arthritis, diabetes, and even cancer. Stimulation of the nervous system could replace drugs for inflammatory and autoimmune conditions. This is, again, 2015 journal based on some science that they're showing that some of the best evidence they're showing is that if we can access and have, now, what's their answer? Drugs that inhibit or stimulate the nervous system. And if you look into that article, they talk about basically going to the vagus nerve. Well, there was another article that just came out, and I'm going to read this one to you. And an article, this one came out, actually I have to look exactly, I always forget the journal that it came of, but the article talked about the vagus nerve. So it came from the Journal of Biological Regulation Homeostatic Agents. So if you have an active vagus nerve, and this was actually June 28th of, or sorry, April, June of 2014, right? So it's all in the PDF that I've written out there, and I've got the kind of the bullets, so you don't have to go through all the details of the study. But listen to the title of the study. If you have an active vagus nerve, cancer stage may no longer be important. So think about that. Okay, so if you have an active vagus nerve, cancer stage may no longer be important. This is incredible. I mean, so I'm just going to read a few lines from this because and then I'll point out what this means. Recent studies have shown that vagal nerve activity independently predicts prognosis of cancer. Here, we take this one step further and show that when the vagal nerve activity is high, cancer stage no longer predicts tumor burden. We examined whether vagal nerve activity, indexed or measured by heart rate variability, moderated the effects of initial tumor stage or tumor burden at follow-up. So as would be expected, initially advanced tumor stages predicted higher tumor marker levels at follow-up than did early stages. Basically saying the worse it was, we're predicting that it's going to get worse. However, this occurred only in patients with low, not high vagal activity. Furthermore, in patients with advanced tumor stage at diagnosis, high HRV, high vagal activity, predicted lower tumor marker levels than did low HRV in both cancers. Estimating a cancer patient's prognosis by determining his tumor stage needs to also consider the vagal nerve activity. Are you catching this? Like this, again, 2014, April, this is huge. This is huge. The activity is easily measurable and it determines in which subjects the tumor stage is prognostic. Importantly, higher vagal activity may even protect against the adverse effects of advanced cancer stage. These findings, observed in 2 distinct cancers, support the hypothesis that neuroimmunology effects of vagal nerve activity on tumors. So let me sum that up. Basically what they did is they took some groups and they found out that even those who had bad tumor, even when they started off, further along stage tumor, worse tumors, cancer tumors, if they had a higher vagal activity measured by heart rate variability, which obviously we know in chiropractic is significant, that's one of the major tools of subluxation analysis, higher vagal activity meant that their tumors did not progress quickly and the prognosis was better than those who had low vagal activity. This, guys, and this is, if you hear nothing else from this, and you hear, of all the things that may, some of the stuff I can go get carried on and get excited, but the bottom line is, if you hear this one thing, this is a game changer. And I've said that a lot already, but the point is, vagal activity is a sign of parasympathetic dominance. We know when you're in parasympathetic dominance, right, that your sympathetic is lowered. Right? You can't have both of them high at the same time. One's they're inverse proportional. So the bottom line is, if the vagal is high, parasympathetic is high, sympathetic is down, that means immunity is up. Parasympathetic up, immunity up. When you make an adjustment, you lower sympathetic, the sympathetic nervous system. That means you increase the parasympathetic. It means you increase immunity. again, I can't get more excited about this. So you ask, well, do we